Good afternoon, members of the press. Good afternoon, Bahamas. Here is the latest update on the COVID-19 pandemic as of Tuesday, the 27th of October, 2020. 67 new cases were confirmed yesterday. This brings the total number of confirmed COVID-19 cases in the Bahamas to 6,549. Hospitalizations stand at 94. There are 12 COVID-19 patients hospitalized in Grand Bahama healthcare system. 16 are moderately ill, and 5 are in the intensive care unit. In New Providence, there are 21 COVID-19 patients hospitalized in Doctors Hospital. 16 are moderately ill, and 5 are in ICU. There are 8 moderately ill patients hospitalized at South Beach Acute Care and Referral Center. At PMH Hospital, there are 50 COVID-19 patients who are moderately ill. There are no patients in ICU at PMH at this time. Currently, the Sandilands Rehab Center is caring for 3 cases of COVID-19. In all, there are 2,207 active cases. 94 persons recovered from COVID-19 yesterday. This brings the total number of recoveries to 4,182 at a rate of 63.7%. Active cases account for just over 1/3. We're happy to report that there were no COVID-19 deaths reported on Tuesday. However, there are 2 today. The total number of COVID-19 deaths account for 136. In total, there have been 27 non-COVID deaths, and 17 deaths remain under investigation. A total of 444 tests were carried out yesterday, and of that number, 67 were positive, 343 were negative, and 34 were identified as repeated tests, which were used to assess recovery. In total, 34,948 tests have been carried out as of October the 27th. You would see in the slide, the previous slide, that there are islands that have reported no cases. However, in New Providence, it is observed that the COVID-19 cases are occurring in the densely populated areas of the island. And as it stands today, cases are being reported in all constituencies of New Providence. Over the holiday weekend of October 10th and 12th, new restrictions were put in place for New Providence and Abaco. With these restrictions in place, there was an increase in travel to Grand Bahama and selected family islands, including Eleuthera, Exuma, and Andros. A quick snapshot of the Bahamas. If we can show the quick stats of New Providence, followed by Grand Bahama, followed by Eleuthera, Abaco, Andros, and Exuma, please. We can also go to the map, the interactive map, which we are pleased to show you in a different format today. As you see in North Abaco, where this describes where the cases are occurring. In Grand Bahama, North and South Abaco. Grand Bahama, we can actually show you the settlements and the percentage of cases where they're occurring. We can advance now to Eleuthera. North Eleuthera. We are able to plot the entire island of Eleuthera. North Eleuthera shows you by settlement, north-south Eleuthera, where the cases are occurring. And you can advance the slides to the other islands, please. North Andros, again, the legend is pretty small, but we can make these slides available to you. Followed by Exuma. Do you have Exuma there? We have both North and South Andros with the cases. Okay. Thank you. West Exuma, East Exuma, and North Long Island. Thank you very much. If we can go to the statistics now of by island. We've recorded the following trends. As restrictions in Grand Bahama were relaxed, the island began to experience an increase in the number of cases. Travel activity led to a rise in the confirmed COVID-19 cases on the island of Eleuthera, and case numbers are steadily escalating on the islands of Exuma and Andros. We are also monitoring, this shows the incident and cumulative cases by Epi Week in New Providence, and you are beginning to see the decrease that is occurring in Epi Week 42 and 43. Next, please. This is following the modeling that we often use, and although we haven't seen a flattening in the curve, we are encouraged that there may be some movement to the right of the curve. Next, please. We look at the new COVID cases per week, and we, because of the irregularities with the lab, we look at the time from when the person is swabbed, and we plot the averages. And as you see, we did peak. Now we are at the point of a decrease, and we hope this decline. You can see the averages on the screen. We moved from 67, we moved up as high as 85, and we're now to 55. Can I have the next slide, please? When we review the statistics by island, we have a correction here that there are no days since the last case. That was yesterday. Today, we have 2. Next, please. When we look at that upward movement, we're really concerned, but we haven't reached that threshold yet where we think that transmission is widely spread. And I'll show you the next slide, please, what I'm speaking about. You have on the 18th, we plot post-incubation period. So you see that high spike. And we are now able to share with you that a major contribution was a super spreader event that occurred between Nassau and Grand Bahama. We're also looking at other super spreader events that we've been told about, but it is clear that that increase is a super spreader event. You see the movement downwards. Next, please. Again, this is the graphic representation. Next. And we have looked at the chains of transmission case by case. And you're not able to see the legend because of the picture in the picture. But the red the red circle indicates with high certainty there is a contact going on, and with the yellow medium and green with less. Next slide, please. These chains increase, and that gives us the determination that these are cluster events going on more than sporadic events. Next slide, please. With Eleuthera is presenting quite a challenge for the healthcare grouping. Next slide. We had a total, next slide, please. You see where the cases are occurring, settlement by settlement, and there have been 3 deaths associated with COVID-19 in one jurisdiction, one settlement in Eleuthera. Again, there is spread the full length of the island. Next slide. When we look at the incident and cumulative cases by epi-week, you see where we are. It's not encouraging, but we hope that we are able to have interventions that are going to slow the spread of COVID-19 on Eleuthera. Next. Again, we looked at the transmission rates over time, the average with the incident cases, and the average, and it's quite different from the other graphs that you have seen. Next. Andrus Abaco. Abaco is a good story. Next slide. And you see what is going on with the intervention and the lockdown. It has really made a difference with the transmission rate. Look how low the bars are in these last 2 weeks. Next. And then again, this is graphically represented by the average, just to make us to be assured that the time intervals are what we are truly seeing on the other graph. Next slide, please. Andrus, 11 cases, 3 active cases, 7 days since the last case, and no deaths. Next slide. And again, if you want a horizontal line flattening, this is an example of it. Next. Exuma, we're watching very closely because the 11 PUI, persons under investigation, is increasing with the activities that went on. Again, they have what we think may be 2 events, one in Black Point and one on the mainland, that will lead to an increase in the number of cases. Next, please. We monitor the hospitalizations. You see the first wave, that period when we had in June, then the second wave began. Now, hospitalizations, there's a lag between the incident cases, when the cases occur, and then the hospitalizations. And what we have been monitoring are those peaks of hospitalization and tying in with the concerns for hospital capacity. And you see very early on, we had 2 peaks that were pretty close together. We had an interval that was longer after each peak. And I think you can see this nicely in this graph. And we are moving down. Next slide, please. And this is the representation of the downward turn in the number of hospitalizations, only recently though. And we hope it continues. Next. The Bahamas is unique. We have a air transport from the Family Islands to Princess Margaret Hospital and South Beach and doctors in New Providence. And as you see this animated slide, airlifts have occurred. This is air ambulance service. Each island, each and every island in the archipelago had a patient that was airlifted. There have been a larger number of airlifts recorded from Eleuthera, Exuma, Abaco, and Grand Bahama. Thank you. The COVID-19 bed assignment at PMH is presently at 78. That was yesterday. 11 beds on the private medical ward, 14 beds on the medical surgical ward, 8 beds in legacy unit, 15 beds in the old general practice area. And with the addition of the 28-bed COVID-19 isolation and treatment unit operated by Samaritan's Purse, the bed capacity now stands at 106. Thank you. As indicated earlier, hospitalizations lag incident cases. Deaths follow after hospitalization. There's a lag time. And we've recorded a total of 136 COVID-19 related deaths as of the 27th of October. Next slide, please. And here we see the cumulative COVID deaths by epi week in this second wave. Next slide, please. Now, this is most informative for us when we were asked the question, were there more deaths by year, and are those deaths related to COVID? So in the blue bars, you see 2019, and in the gray bars, you see 2020. And in the yellow, you see the COVID contribution to the number of deaths in that stack. The interpretation now is that you have a difference. If you go to August, deaths did occur in July, but look at August. In August, the difference between 2019 and 2020 is the difference between 224 and 312. And the difference, 47 of those deaths contributed to 312. So it gives you the math that there is excessive deaths occurring in this environment of COVID. Next slide, please. And here we have the comorbidities diagnosed among the deceased COVID-19 cases by sex in the Bahamas. Next slide, please. When asked if there is a difference between male and female, I responded that the virus is asexual. It likes both. And really, we try to find, there may be a preference for for males, but it's more or less evenly distributed when you look at the numbers. Next slide, please. And we try to monitor the crude transmission rate. And we've been asked repeatedly, when are we going to stop having lockdowns? What numbers are you looking for to determine whether or not you need a lockdown? And this is one tool that is used to measure the transmission rate of the virus. And we are hoping that we will be under 1, that value would be under 1 and give guidance. When we're under 1, you can't see the ordinate scale, but when we're under 1, we do have some, it isn't an assurance, but we feel that we can manage the reopening a whole lot better. Next slide, please. In order to do so, we must have aggressive, active contact tracing. And this is a good story. you see the number of contacts we have made with the addition of the many contact traces that joined us a week and a half, a week ago. Increased contact tracing by 160%. And this has allowed us to focus on monitoring lab services as well. We are monitoring, as we do contact tracing, we are monitoring labs that perform the nucleic acid amplification test, or RT-PCR, COVID-19 testing. And we are working to improve that significantly. We also have an active data monitoring team working closely with corporate partners to improve the analysis process of surveillance data. And this began this week, and we are truly indebted and grateful to our corporate persons that you would hear more about from the PM. Various government agencies are also assisting with the management of quarantine facilities in government-run facilities. The enforcement unit of the Royal Bahamas Police Force is assisting with adherence to public health measures. We continue as a health team to promote, advocate that the gold standard of laboratory testing for COVID-19 virus is through nucleic acid amplified testing, or RT-PCR testing. We're pleased to let you know that results are now being received by the contact tracing unit within 48 hours of testing. The surveillance unit is actively monitoring the length of time a lab takes to report its results to the unit. And a full report of lab performance will be included at the next Ministry of Health press briefing. We want at this time to appeal to all labs carrying out COVID-19 testing to provide to us completed case identification forms with clear identifying information. I want to strongly urge persons who present for COVID-19 testing to restrict their movements until they have received their test results. This simple but effective action can prevent the spread of the virus should you end up testing positive for COVID-19. This virus is highly transmissible. Its favorite host is you. It takes every opportunity you give it to infect you. The pandemic is not over. There is no cure. There is no vaccine. Experimental therapeutic medicines are not readily accessible and available to the general public. We must consistently apply the public health measures that we already know work effectively. It is well established that 40% of persons who have COVID-19 are asymptomatic. We all know that restrictions alone will not work. Therefore, we each must take personal responsibility and follow the preventative health measures to slow and hopefully stop the spread of this virus. As we approach the holiday season, we must begin to think about transitioning to a new way of interacting with others. As we reopen the country, we anticipate an increase in the number of new cases, but we can still slow the transmission of the virus. The data show our cultural behaviors are also increasing the spread of COVID-19. Our cultural behaviors often involve congregating in larger than 10 gatherings, larger than 6 at parties, churches, and mainly the fellowship after church, family get-togethers at the beach, weddings, funerals, and places like the fish fry. We've had 136 deaths. Such cultural behavior may prove quite deadly. So let us be safe and do our part to stop the spread of COVID-19 in the Bahamas. It gives me pleasure to introduce the Prime Minister, the Most Honorable Dr. Hubert Minnis.
Thank you very much. Bahamians everywhere, ladies and gentlemen of the press, good evening. Thank you, Dr. Dahl-Regis, for your update and for your ongoing service, along with the service of everyone on the front line of this pandemic. This afternoon, I wish to address the country and the media on our ongoing and comprehensive measures to continue to aggressively respond to this terrible virus, after which we will take questions from the press. This pandemic is exhausting and costly physically, spiritually, emotionally, and economically. We continue to lose some of our fellow citizens to this virus. I again offer the country's condolences and my personal condolences to those who have lost loved ones. Let us continue to pray for those who are ill and who are recovering. The major slowdown in global travel continues to devastate our tourism-based economy. We all want to be back to our normal lives, but with this desire, we must be reasonable and discerning. We are working daily to try to balance the health, economic, and social needs of our people throughout our archipelago. The pandemic is far from over. Sadly, the Northern Hemisphere is likely heading into the worst period of the pandemic. With fall already here and winter coming, colder countries face a very challenging winter. More individuals will be indoors in these places. The virus spreads easier indoors where there is poor ventilation. COVID-19 cases are soaring in countries around the world, including in the Americas. Experts are saying that the next few months will be a dark, dark winter. In fact, the global COVID-19 public health emergency is worsening around the world. By example, quite a number of European countries that were doing generally well and better over the summer are now heading into a difficult and painful winter. There will be many more hospitalizations and deaths in a number of European nations. And let me say to the Bahamian people, do not be misguided by those who engage in magical thinking. They want to wish the virus away or think there is some simple solution to the complex challenges it causes. But let me be very clear. All indications are that the pandemic will be with us well into next year. We must incorporate the public health message of physical distancing, avoiding mass gatherings, mask bearing, and regular hand washing or sanitizing into our everyday lives. We must also get used to the cycles of tightening and loosening restrictions until there is an effective vaccine and the overwhelmingly majority of Bahamians are vaccinated. We will have cycles where cases go up and cases go down. And this will occur because the virus spreads easily, especially when we do not wear our mask or we go to social events, including family gatherings, where the virus may quickly and easily spread. When cases go up on a particular island, we will have to increase restrictions if necessary. But if cases are low on other islands, they will remain open with less restrictions. Restrictions are not a punishment for the island with a problem. The restrictions are a public health tool to promote more physical distancing, which can save lives. When cases are high, maintaining safe distances help to reduce the spread of this deadly virus. It is important that we understand that these cycles of tightening and loosening of restrictions are part of life in the pandemic. If cases spike and no restrictions are put in place, the virus will run wild and infect and kill more people. Countries around the world are going through their own similar cycles. In fact, some jurisdictions in Europe are currently imposing more aggressive restrictions than we have here in the Bahamas. Some of them are going as far as multi-week lockdowns and stricter curfews. Ladies and gentlemen, given the current situation throughout the country, the Cabinet has agreed to the following measures after consultation with our health officials. Effective Friday, the 30th day of October, at 8 p.m. to 5 a.m., weekday curfew will apply to New Providence, Abaco, and to Grand Bahama. What that means is the curfew that presently exists in New Providence, commencing at 7 o'clock, will commence at 8 o'clock instead. And that in Grand Bahama, that commence at 10 o'clock, will likewise commence at 8 p.m. We want to, as quickly as possible, address any community spread on Grand Bahama. On Grand Bahama, weddings will now be limited to 10, not including the officiant. Also on Grand Bahama, funerals will now be limited to 10, and graveside only, not including the officiant and mortuary workers. Due to the increase in COVID-19 related activity on Eleuthera, Spanish Wells, and Harbor Island, the Ministry of Health will dispatch an emergency team to assess the situation, as was done previously in Bimini. And following this assessment, a determination will be made on what specific measures may be needed for Eleuthera, Spanish Wells, and Harbor Island. On Abaco, food stores may now open on Saturday from 6 a.m. to 7 p.m., in addition to the weekly hours already done. All beaches and parks on New Providence and Abaco may open effective Monday, November 2nd. that is Monday through Friday. The beaches will remain closed on Saturday and Sunday. Groups are limited to 5 individuals, and the COVID-19 enforcement unit will heavily monitor both beaches and parks. For the construction industry, companies on islands under 24-hour curfew may apply to the competent authority for permission to operate over the weekend, effective Saturday, October 31st. Exercise is permitted in one's immediate neighborhood from 5 a.m. to 9 a.m. on New Providence and Apico, that is, on Saturdays and Sunday. Before November 1st, tourism officials will provide a further update as it relates to the reopening of tourism, including information on the operation of restaurants and tourist-related activities. Health officials will evaluate the rate of transmission 2 weeks following the reopening on the 1st of November to further guide our response. Let me be very clear. A negative RT-PCR test for COVID-19 is required for all individuals entering the Bahamas, including Bahamians and legal residents, regardless of the amount of time an individual has been abroad. And I wish to remind Bahamians and residents that you should have sufficient funds to cover the cost of the necessary test and any other COVID-19 related or medical expenses that may arise during your travel. To put this in simple language, I advise Bahamians, as we open those who travel abroad, to have sufficient funds in the event you are tested positive in that particular country and they require you to be quarantined for 14 days. Let me reiterate that the 24-hour weekend curfews remain for both New Providence and Apico. Other measures outlined in the number 8 emergency orders for New Providence and Apico also remain in place, with the exception of the reopening of beaches on those islands and the operation of food stores on Saturday on Apico. We continue to advance a range of measures in our fight against COVID-19. I thank those who have led and have been involved in our aggressive contact tracing program. This includes, more recently, pilots and flight attendants from Bahamas Air, and our corporate partners, including BTC, Alive, and Pricewaterhouse, and those who have donated equipment and other resources to our command center. Over the course of the pandemic, 230 individuals have been involved in the contact tracing process, and of these, 170 are currently still assisting with contact tracing across this archipelago. Of the 170, 119 are on New Providence, 29 are on Grand Bahama, 6 in Eleuthera, 4 on Abaco, and the remainder are on other family islands. Let me again note that we have increased our hospital capacity on New Providence. Recently, in partnership with the Samaritan's Purse Relief Organization, we opened a 28-bed COVID-19 isolation and treatment unit. The tented inpatient facility is located adjacent to the Princess Margaret Hospital. It also serves as a COVID-19 referral center for the Bahamas. Along with the Minister of Health, I have met frequently with all of the testing labs The objective of the meetings is to increase the speed that results are provided to the surveillance unit. The goal is for 48 hours, and I'm very pleased to say that there have been considerable improvement. Where impediments have been found, such as the time it takes to get swabs to the testing labs from the Family Islands, mitigating measures have been put in place to expedite the processing and testing once these swabs arrive here in New Providence at our labs. In conjunction with the Ministry of Health, a protocol has been put in place by the labs to request all symptomatic persons to quarantine until results are delivered. And this collaborative effort with the private labs will continue. I wish to also note that we are making progress on another way to test that is less invasive. Health officials will have more to say about this in due course. I also wish to again urge employers to be as flexible as possible to help reduce the risk of exposure and the risk of transmission. Please allow those who can work from home to work from home, stagger work hours, and consider moving payday to other than Friday to give staff more time to prepare for weekend curfews. Let me again thank all in the business community who have continued to follow and to enforce the health guidelines and measures. I wish to assure the business community and the private sector that we are working hard and diligently to balance the health and economic needs of our country. I again thank the many corporate citizens who have shown extraordinary consideration to their employers. And I thank those businesses and private individuals who have donated money and goods, including donations of food for those in need of assistance. Ladies and gentlemen, let me again emphasize that our personal and collective behavior are the key to reducing the spread of this highly contagious and dangerous virus. It has to be our shared mission to protect one another, especially our seniors and elders. While enforcement is critical, few countries have the manpower and ability to fully enforce the health measures and restrictions, and we are no exception. This is why personal responsibility is essential. It is vital. Many Bahamians have told me that they are deeply concerned and disturbed that some of us are continuing to host unnecessary social gatherings and parties, which are helping to spread the virus, leading to serious illnesses and death. I was recently told of this story, which sadly represents so many other examples of those who still are not taking this virus seriously 8 months into the pandemic. A young man was frequently going out with his friends and frequently ignoring the lockdown rules by participating in parties in private locations. Several weeks ago, his mother, who is in her mid-70s and with whom he lives, began to display symptoms of COVID-19 infection, and the infection was confirmed. She was hospitalized for 2 weeks and was recently released, but is now a shadow of her old self, in that She now needs full-time care. Who? Who is the only full-time caregiver available? It is now her son, from whom she caught the virus. His lifestyle and wanton disregard for the pandemic rules have left his mother disabled and has now severely compromised his freedom. We live in a community. There is no such thing as warding off less vulnerable younger people from more vulnerable older people, as this case clearly demonstrates. We will continue to enforce and to ramp up enforcement of health measures and restrictions. I again thank those who are following and complying with the health measures. But I will continue to stress that enforcement alone is not sufficient. We must also be personally and socially responsible. The government cannot be everywhere all the time, nor should it be. In a democracy, we have to act as responsible citizens and be concerned about the common good. Government has its responsibilities, but so do citizens. In this spirit, I want to again raise the importance of adhering to the health guidelines, including when visiting with families and close friends. And during this pandemic, when interacting with anyone you do not live with, it is better to do so at a distance outdoors rather than indoors. You should also always keep your mask on. This advice also pertains to visiting with families and friends. If you decide to visit indoors, we still recommend you must maintain distance. Keep your mask on and keep windows open for better ventilation. Since the beginning of the pandemic, the home setting has been a major area for transmission of this virus. Do not let your guard down when visiting with family and close friends. In the medical field, we begin with the assumption that anyone and everyone is COVID positive. It is normal to feel frustrated with this pandemic. We are all deeply frustrated. Normal life has been interrupted for an indefinite time, and no one knows when it will end. However, do not let pandemic fatigue cause you to lose your life. Millions of people around the world have lingering COVID-19 symptoms. Some of these symptoms are very serious. Scientists do not yet understand all the long-term effects of this disease. They do not know how long the damage it causes will last. And we must adjust our minds to embrace the constraints of the times so you can make it to the post-COVID world healthy and strong. Do not become reckless in frustration and catch this virus. Researchers are making significant progress. In time, there will be a vaccine and more medicines. Follow the health advice so you make it to that time as healthy as possible. I urge you to please be patient. Please be disciplined. And most of all, please stay safe. Let me thank the many Bahamians, including church leaders and ministers, who daily pray for our country and who are helping those in need. I thank those ministers who have called me personally and who have offered their prayers for me and my government. We are sustained by these prayers and words of hope and encouragement. I could not do this work without these prayers and without the love and perpetual blessings of the God who sustain us all. My prayer every day is for our country, especially for the poorest and most vulnerable in our country, whom Scripture calls us to be at the very center of our daily considerations and concerns. And every day and throughout the day, I continue to ask Almighty God for direction and discernment. I ask Almighty God that I may do what is right and good for the Bahamian people, whom I have the privilege of serving in this office. I thank all Bahamians who continue to work in a spirit of love and unity, and who have chosen the spirit of togetherness over division and disunity. We must continue to work together to defeat this virus as one people, united in hope and fortitude. And as I speak to you today from my home here in quarantine, be assured that we will defeat and conquer this virus, and we will enter a new life in the post-COVID era. May God bless our Bahamas, and may God bless each and every one of you. And now open the floor for questions from you, members of the press.
Thank you, Prime Minister. And today we have with us lab experts, Doctors Indira Martin and Jessica Edwards. We have the public hospital, Princess Margaret Hospital's medical advisor. We have the administrator, the chief hospital administrator, and we have the policy brass of the Ministry of Health. And we have Dr. Forbes on Zoom, Dr. Gillian Bartlett from Nassau, and Dr. Frank Bartlett from Freeport, and Dr. DeLon Brennan. And I'd like to invite Outreach Minnis if she has a question. But before I do that, we must also say a heartfelt thank you to the National Health Insurance team that has become family at Malia with the public health staff. Outreach Minnis, please.
Good afternoon, Dr. Dahl-Regis, healthcare professionals, Prime Minister, and the Bahamas. My first question is for the Prime Minister. Sir, I'm wondering, since the government has expressed along with you that the country is now in economic peril and so many Bahamians are experiencing this peril due to the COVID-19 pandemic, is government considering free and or routine testing for those residents, especially here in New Providence, who would want to take a COVID-19 test but can't afford it?
I know you've heard that statement coming from the leader of opposition. PLP lives in an Alice in Wonderland of fantasies. They must stop using politics and one day face realities. We would do whatever is necessary to ensure the safety and survival of our fellow citizens. Next question.
My next question, sir. In Parliament this week, several members of Parliament are questioning who or what comprises the competent authority, as they're noting that the competent authority is operating under a dictatorship. Can you please use this opportunity to confirm who is the competent authority and who assists in making the final decisions on behalf of the competent authority during this COVID-19 pandemic across the country?
As Prime Minister, I'm chairman of Cabinet. We discuss matters And there are some matters that I would appear as the voice of cabinet. The competent authority is the voice of cabinet. Yesterday, we would have had extensive, long cabinet meeting, after which we would have met with the health officials. They would have advised us as to the way forward, after which cabinet, we would have come to a conclusion. And I am only representing the conclusion came to by cabinet. So the competent authority is only the voice of cabinet.
Thank you very much. Mr. Jared Higgs, please.
Good afternoon, Bahamas. Dr. Minnis, this question is for you, sir. Thousands of Bahamians have been out of work for months and are falling behind on bills. Chief among those bills is rent, and the pressure is on both landlords and tenants to meet their obligations. What do you say to Bahamians who are in desperate need of rental assistance right now?
At present, we have programs via social services. As you know, government's revenue stream has basically almost stopped flowing. So government itself, we too are experiencing the realities of what's happening. But in spite of that, we would do all we can to assist wherever possible. And in fact, we realized that since this COVID pandemic, a lot of our citizens would have experienced great difficulty with the payment of utility bills, light and water. And that is essential, especially during this pandemic. And Cabinet will be discussing a plan moving forward so as we can assist individuals who have been directly affected by this pandemic.
Do you have a second question?
Yes, please. Thank you for that answer, sir. Second question is, what is the rationale behind allowing individuals to attend church for services in a socially distanced environment, but not permit the same number of people in that church for a funeral service or a wedding? I ask this question in particular because people are having a very difficult time, as you can imagine, when it's time to bury a loved one. And of course, you cannot go about things in an ordinary way. So what's the rationale behind allowing church, but not maybe allowing a funeral in a socially distanced church?
Well, both you and I would have attended funerals previously. I'm certain you would have attended some funeral at some point in time in your life. And you would see that it's a sad moment. And individuals can sometimes, through the experience of bereavement, cry and display their sadness of the dead and embrace each other and shout, scream, arms in the air, socialize, embracement, and individuals have to be taken away. So there's greater risk of socialization with a funeral than with what you just mentioned. And we base our decisions on data.
Thank you very much. Matthew Moxie, please.
Yes, good afternoon. My question is for the Prime Minister. Health officials have gone on record to express that we are not ready to reopen our borders. They especially think the removal of the 14-day quarantine will be detrimental to public health and will introduce even greater challenges. So in your view, sir, are we prepared to handle an influx of cases if this go around results in anything like it did the last time we reopened our borders? And we do know that there is a aggressive testing regime, I think, now in place where individuals will have to test 3 times with the rapid antigen test. But as you are aware, in some instances, things may slip through the cracks. So do you think we are prepared for this and have the capacity to handle if this goes left?
Allow me to repeat what I said. Yesterday, we had a very extensive cabinet meeting, after which we had discussions with health officials. What I said today, what I presented to the Bahamian people would have been in discussion and advice of the health professionals. Dr. Dahl-Regis would have mentioned that there is a possibility of a slight increase, and we must be prepared to deal with that. But we all have a responsibility if we are to decrease this virus, and if we are to conquer this virus. If we are to remain safe, we must be responsible, we must be disciplined, we must wear a mask, we must sanitize, and we must engage in social distancing. Government cannot do it all. We all must do our part. And once we do our part, we will be up to the challenge.
All right, thank you. And then my second question is, the Economic Recovery Committee recommended that government's weekly benefit assistance be reduced. Is the government minded to follow this recommendation? And do you, sir, believe that this is sufficient funds that persons are getting in these benefit assistance?
As I repeated, thank you very much for that question. As I repeated earlier, we are a nation, 80% of our employment relates to tourism, direct or indirect. Tourism makes up the bulk of our GDP, about 60%. Financial sector, 20%. Our revenue stream has decreased dramatically. We have challenges. We must review what we can afford and make the necessary adjustments so that we can help as many as possible. We are guided by the revenue that we have. We are guided by our loans, and we are guided by what we have within our national insurance portfolio.
Thank you very much, Matthew. Madam Jasper Ward, please.
Good evening. My first question, welcome back, by the way, Dahl-Regis. We've missed you. My first question is for the Prime Minister. What is the rationale behind permitting individuals to shop in grocery stores, but not in pharmacies or in hardware or other stores? How is the risk any greater in a pharmacy?
That was discussed extensively. Pharmacies has other amenities, and they offer other services within the pharmacy. It's not difficult for individuals to call in medication and collect their medication. With these additional amenities within the pharmacies, we feel that that would encourage individuals to congregate, etc. And we know for a fact that pharmaceuticals can, curbside can easily be managed with pharmacies.
My second question is for you, Mr. Prime Minister. As you've noted, the Bahamas' revenue stream has decreased significantly. Thousands of Bahamians remain unemployed or furloughed. In August, while speaking in the House of Assembly, you said, and I quote, "Our lives obviously will change, but we cannot lock down, open up, lock down, open up. That can't continue, and therefore we will have to determine the number and level we can live with." In your speech today, you noted that Bahamians should get used to the cycle of tightening and loosening restrictions. With our economy in peril, can you say what led to your change in your sentiment?
Thank you very much for that question, Jasper. I think you should listen very carefully to what you asked me. You spoke about lockdown. Lockdown and tightening are two different phenomena altogether. So you're talking about apples and grapes. When I spoke about lockdown, I say you can't go lockdown, open, lockdown, open. Tightening is different. For example, in Grand Bahama, curfew started at 10 o'clock. We brought it to 8. That is tightening. Bimini, when we locked down, no man moved, no man got hurt. They stayed indoors. Everything was provided. That is lockdown. There's a distinct difference. Any other questions?
Already had two. Jasper, you're being invited to ask another question, I think.
Thank you very much. I love third questions, really. My third question would be, have the weekend lockdowns been having any measurable impact?
That's for me or the health professionals, because I'm sure you looked at the graph. If you looked at the graph that was displayed, you would see that there's now a downward slope, but we must continue to monitor it, and we will have new data next weekend.
But we've had a decrease in testing according to the numbers provided by the Ministry of Health. So can we really say that they are having a measurable impact when we're having a lower number of tests conducted daily?
Allow me to repeat. If you look at the hospitalization, you look at the ICU unit, you look at the number of individuals that have recovered, you look at the number of individuals that are in hospital, and you look at the graph that was displayed earlier, there was a downward slope. Now, I'm certain that the health professionals can expound further on this.
Thank you very much. Karen Bain, please.
Good afternoon. Good afternoon, Mr. Prime Minister. My question is for the health officials. Several schools in Grand Bahama has seen an increase of teachers infected by COVID-19. One primary school in particular had to be closed for deep cleaning. What are the recommendations moving forward to safeguard our teachers, faculty, and students regarding face-to-face learning?
Oh, Dr. Frank Bartlett can answer that.
Oh boy, this thing not opening up at all. Good afternoon. As it relates to what we do when we have anybody test positive in the school, first and foremost, the disease surveillance teams does an evaluation, they do a risk assessment. So in the case that you would have referred to or referenced, we would have went to the school, we would have identified areas, how movement within that school, how contacts within that school. As it relates to how and what we do when we have a case within the school, be it from a staff member or from a teacher or from a student, then we look at the risk, and based on what the risk is and what we see happening in that school, make a determination as to what are the next steps within that. We have within our plan what we call triggers for closing. If it's a situation where we have one class involved, maybe one or two students, we identify and we look at whether or not it warrants closing that class down. If we see we have more than one or two classes closed down, persons involved in other classes, then we will be more likely to recommend closing that class. With the schools that would have been implicated, the one school, the primary school that you're referring to, person when they would have gotten sick or ill, they would stay home and quarantine appropriately. And as a result of that, when the test occurred, by the time we would have completed our evaluation, most of the quarantine would have actually been done without any increased incidence within the school. We have no other reports of anybody else in that school as it relates to students being involved. And that is usually the process that we take. So as far as the outcome, we have a plan. We have discussed the plans with the different schools. That is something that is active and something that is ongoing in Grand Bahama. Over.
Thank you. Do you have another question, Ms. Bain?
Yes, thank you very much, Dr. Bartlett, for your answer. My question is for the Prime Minister. Sir, there are several cases before the court regarding infringement of the government on the residents' fundamental rights. Can the government shoulder these additional financial burdens at this time in the event the government has to pay out any funds on their behalf?
The government would do what is legal. I would not want to comment on court cases that you mentioned, but government, we're a democratic government, we're a democratic society, and we would honor and respect court's decisions.
Thank you. Mr. Richard Roll, please. Can we then go to Roston Jones and come back to Richard Roll? Mr. Roston Jones?
Good afternoon. If you can hear me, I'm with you. And my first question is, health officials have advised that COVID-19 will be with us well within 2021. The existing state of public emergency, the existing emergency orders will expire or will come to an end in December. And the question for the Prime Minister is, what is the plan, or how long do you foresee the state of emergency being in place, and when will we transition to effectively the new normal? And what's the plan to manage the new normal after that?
I don't know the answer to that question. I don't know how long we would be in an emergency state. I think the health professionals are doing an excellent job, as the data demonstrates. And I'm sure they would continue working along that line. And we expect to see great improvements. And once we reach that level, I would hope to remove those emergency orders. But most importantly, want us to still be compliant and be as disciplined as possible and do their part as we continue to go on.
Do you have another question?
Certainly, I have a few questions. The
Just
second
to-
question. The second question is tourists who test positive upon entry into the Bahamas, especially with the full tourism reopening on November 1st, where will they be housed to isolate if they test positive at the airport? I recall that Breezers was being used for that purpose, but we heard at a couple of press conferences ago that that facility is no longer being used to isolate and quarantine patients. What facility is particularly identified to do so?
Okay.
Well, Minister of Tourism will speak to all of that when he gave a report to the nation, I think Saturday or Sunday, just before we open. But in addition to that, the only thing I would say, so as not to preempt the Minister of Tourism, I would only say that health insurance is a part of the package. So those tourists would have a COVID type insurance, and therefore they can be flown back to their respective destination by their insurance.
Thank you. If we have time, I'll come back. Is Rashad Roll ready?
Yes, I am.
Kindly proceed. Do you have a question?
Yes. Dr. Dahl-Regis, I know recent studies seem to show that the newer antigen tests are decent at detecting COVID-19 in symptomatic carriers of the virus. But how effective does your team believe these tests are at detecting COVID-19 in asymptomatic carriers? And are you satisfied that this antigen test protocol is solid enough to prevent us from being where we were in July, considering that's what our current reopening strategy seems to hinge on?
Thank you for that question. And we have present two lab experts that would respond to that.
Good afternoon. Thank you for your question. So the Ministry of Health is actually actively looking at the performance of the rapid antigen diagnostic tests for use in our population. We do feel that once the test has been approved and is satisfactory for the use of this test in the country, we should be able to use it effectively in symptomatic patients, particularly symptomatic persons being those that are having signs and symptoms that suggest a COVID-19 infection. We also think that this test may be useful in the population where contacts have been exposed to cases confirmed to be positive for COVID-19. Additionally, the test may be useful in our hard-to-reach areas where testing for the nucleic acid amplification test or the PCR test may not be accessible. So perhaps in our family islands. However, outside of that, the Ministry of Health at this time does not recommend using those tests for the asymptomatic population for wider screening. And so it would not be a useful option at this time. Thank you.
Dr. Jessica Edwards, thank you very much. Do you have another question, Rashad Rowe?
Yes. What are the recommendations of your team in terms of what should happen when people arrive in the country? My understanding is that people who come here will take the antigen test at the airport and be allowed to leave the airport while the test result is emailed to them about 30 minutes later, something that can present risks. Are you able to confirm this? And are you able to say what are your recommendations in terms of how that should take place?
Yes, we can say that we have shared those recommendations with the Minister of Tourism and also with the competent authorities. And I'm advised that they would be detailed to you on Saturday. And because I'm not giving you a direct answer, I can invite you for another question.
Yeah, okay. So the Bahamas Association of Medical Technologies released a statement today saying that the antigen test should not be sold to businesses and organizations that lack the necessary capabilities because of the risk infection. So can we get some assurances regarding who's allowed to administer the test, especially like the fact that hotels will be responsible for testing visitors after 5 days in accordance with the new protocol?
Yes, we're happy to answer that question. Dr. Martin.
Good evening. Thank you for the question. So what we are doing in the lab grouping at the Ministry of Health at the moment is developing processes to ensure that any antigen testing is quality assured and that anyone who is using the test is trained appropriately and is being monitored via external quality assurance and so on to essentially guide the rollout of that test. And I want to congratulate you for your excellent question also with regards to the use of this test in asymptomatic individuals, because in fact there is a lack of data in that particular population, asymptomatic individuals, and the recommendation thus far from the WHO has been for use in symptomatic individuals. Thank you.
Elizabeth Bryan, please. Are you having challenges? We can move to Tyler. Tyler
Hello, good
Simonet.
afternoon.
Oh, hello.
Hi,
Good day.
Yes, I was muted. Good afternoon. This is Elizabeth Bryan here with the Lutheran newspaper.
Yes, ma'am.
Thank you. Good afternoon, Dr. Dahl-Regis and Prime Minister Minnis. Thank you so much for all of the detailed information you gave on Eleuthera. My first question did have to do with things like currently active cases, locations, recovered cases, deaths. I believe you did share some good information and we'd love to receive those graphs as well. So I would like to ask about the emergency team that was announced about to visit the island. In terms of when will that emergency team be dispatched? What will that visit look like on the island? And how soon after the assessment team is here will a decision be taken on the measures needed? And when might those measures begin?
Can I invite Dr. Jillian Bartlett to respond, please? That's a three-part question, Ms. Bryan.
Yes, please.
She may be muted.
Sorry, good afternoon, Dr. Dahl-Regis, Honorable Prime Minister, members of the press. Ms. Bryant, hi, can you repeat it's a three-part. Can you give me the first part, please?
It was the team to do the assessment on island. How soon can they expect that team to be mobilized?
I am not sure.
Yeah, it's a work in progress. I don't think we have the exact dates, but but I know that there is activities being planned in terms of staffing to respond to the needs across the entire island of Eleuthera. Dr. Bartlett would like for you to repeat your second part of the first question. She wanted to.
So if you're not too sure as to when the team will be dispatched, how soon after assessment is done will a decision be taken on what measures are needed and when might those measures begin? So basically, once a team is sent, how long do you think before announcements are made about what will actually happen going forward on the island?
Yeah, we will follow the model that we did in Bimini. We know that whatever the assessment team goes down to Eleuthera, when they go, they must work with the local team. I'm told that the local teams would be out of quarantine in 2 days' time, and they will partner with them to do the work. They're on the ground and they know. In we anticipate that with the once it would take probably they would tell us, but we anticipate it would be done within a week. We're hoping that the teams that go down also have meetings, town meetings with the various persons to explain to the local community what is being done, why it's being done, and what the recommendations would be. They would forward the recommendations in real time to the Ministry of Health staff. So in Bimini, this with the preparation took a good almost 10 days, and it required the assistance of the media, the leaders in the community, and the persons affected and their families. So we anticipate that it will take a little time, but surely within, I would say, a week to 10 days, we would have a better idea of what the intervention should be, because that is what we're looking forward to, is the intervention to decrease the spread of the virus, if not contain it. And you see with the graphs we presented, we have the distribution of the cases by settlement. So that helps us even further. We didn't have that when we went to Bimini, and we're really grateful to two of our senior medical students who've done those maps for us. But we'll get back to you with that information as soon as we have it. But that's the outline of what is being proposed. Do you have another question?
So much, Dr. Regis. Really appreciate that thorough answer. Now, we have heard stated concerns in reference to the logistics of transporting sick COVID patients and transporting the deceased across the island, inclusive of our waterways. Can you describe measures in place by the Ministry of Health to minimize points of exposure for frontline health workers? And can you confirm whether or not there have been health workers who have been tested positive after possible exposure to deceased COVID patients in Luther?
I would like Dr. Bartlett to be given an opportunity to answer that question. Dr. Jillian Bartlett.
Good afternoon again, Ms. Bryan. I think the first part of your question was deceased clients, to minimize the passage or the movement of deceased patients into or across Eleuthero or even into Nassau.
And if any health worker tested positive
Okay.
dealing with the
As a
deceased.
result of that, okay. So what we have developed along with pathology, Ms. Bryan, is what we call a pathology process pathway, whereby if we are thinking that the deceased may be COVID related or may have died from COVID, we normally would do a swab posthumously and have that swab sent in for confirmation. In the meantime, we ask that all persons who are dealing with the deceased, that they be properly clad with their full PPEs from head to toe, and that the body is double bagged for protection before being placed in a cooler or someplace to store it until the body can actually be transported. But what the pathology process does, it allows us to be able to sign a death certificate on the ground without having to physically move that body. So the physician, once they, or the healthcare provider, normally in this case, because it's a pathology process and the physician have to certify it as dead, what we will do is fill out what we call a pathology requisition form. We would send it to pathology. Pathology would then review and then send it back to us. What that allows us to do is fill out a death certificate on ground, and then we can then give it to the right individuals, and so that deceased can actually be buried. And we try to turn this process around in 24 to 48 hours to get the process moving, and so that the family can bury their dead with respect. The other question is, to date, there is no confirmation of a healthcare worker coming down with COVID-19 as a result of exposure to a deceased individual. Good afternoon.
Thank you, Dr. Bartlett. Can we go to Tyler Simonet, please?
Yes, good afternoon, Mr. Prime Minister, Dr. Dahl-Regis, the health team, and to all who are listening. My first question is for the Prime Minister. There have been some complaints that employees who have been possibly exposed to the virus while on the job feel that it is unfair having to foot the bill of their COVID-19 test. Has the government considered doing anything to where employers are legally responsible for making sure their employers' COVID-19 tests are paid for if they were exposed on a work-related incident?
No, that's a matter that's under discussion. But I was exposed. I'm here locked down for 14 days. These are the realities. Next question.
Oh, yes. My second question, wondering if it could be just something for clarification. Would it be possible to get some more clarity on the active cases in Grand Bahama? Because on October 16th, Grand Bahama had 57 active cases, and now today, just 2 weeks later, it's announced that there are 582 active cases. Can we get some clarity and details on that super spreader event that Dr. W just mentioned?
Dr. Bartlett, yes, the stats are not quite lining up. Dr. Frank Bartlett, please.
Good afternoon again. The actual number and the number that was reflected on the chart today was incorrect. The active number of cases we have on the island right now is 105. So as it relates to the number you would have seen, the 585, that's not a correct number that you're seeing there with the active cases. Over.
That was the cumulative number of cases, Mr. Bennett.
Active cases being monitored right now is 105.
Thank you. Christina Dragovich.
Good evening, everyone. Good evening, Prime Minister. I wanted to revisit a question that was asked earlier. When it comes to free testing, many Bahamians are calling for it in a nonpartisan arena. Is that something we are considering? Is there a plan to ramp up testing, especially for those who are not traveling but may be susceptible to community spread?
At Princess Margaret Hospital, the lab, those tests, patients are not charged for those tests now. So they are free testing by the hospital.
It's a protocol that they must follow.
Thank you. Thank you for that answer.
Do you have a second question?
Yes. Also, as it relates to the November 1st deadline and reopening of the country, will the 14-day quarantine requirements remain in place for travelers to New Providence, or will they be lifted as previously announced?
I think when the Minister of Tourism speaks on Saturday or Sunday, he would give a more detailed information as to what exactly will happen.
Thank you very much to each of you. That concludes our press conference. Good afternoon.